Also the price of fuel. So we know that there is a real impact on women getting off farms in drought conditions. So just for prices and particularly male farmers starting to look at the budget and going, well, do you actually need to go into town this week? Actually, for people to get off the farm, they need to. And we know that women and the networking is actually essential that they're getting off that farm. So how do we know this? Have we guessed it? Well, actually, funnily enough, we did. The first thing we did was look internationally. I had a health promotion expert working with me, and she did a literature review across the world, looking at who had tracked climate change to the sort of social determinants of health and population health and health promotion. Couldn't find anything. So I remember just jotting it down to myself, thinking, what would be the obvious things that we know of in social determinants of health, and how would they link to climate change? So I remember sort of circling them down on my page. Well, Joe, don't you reckon it's about, food, water, transport? Aren't those sort of classic things that we need to be thinking through? Virtually, the ink had hardly dried. About a week later, our Victorian Council of Social Services, VCOS, released a report in November 07, which gave the whole story about exactly that. They've mapped a fantastic report, mapping out how climate change will impact on people most disadvantaged. So if you're disadvantaged, this will amplify your situation. We also I'd been involved in 2009. I was invited to do two things with the Rural Women's Network in Victoria. One is to run some workshops to survey and question women about what they saw as the largest impacts for them as women from climate change. And then I was invited to review the input from 700 women across the state and to bring out themes about health. And how I've summarised this at their conference was to say, well, what I saw from that input from 700 rural women was that they were talking about what I would call sort of the left-hand indirect impacts of climate change that we've just talked about. Particularly mental health for them was absolutely number one. Social connection was huge. And interestingly, gardening, the impacts of no water. Actually, rural women rely on having that veggie garden, yeah. So the restriction on them for their gardens, also their gardens as a sense of what would you say, mental health and an oasis, they would call it, from a pretty harsh environment. That's an important part of our rural psyche, is to have a little garden around you. So what I didn't hear, and what was fascinating to me because I've been tracking in our work, was that the right hand was sort of the government talking about the disease vectors and the extreme events and respiratory illnesses, etc. The kind of the right hand direct medical impacts, and the sort of the left hand, which we'd been tracking, and these rural women had basically validated that that's what's of most interest to people. So where did we go with that? We really then started to look at, and this document shows this, well, the clear question is who's most vulnerable? Three categories that we looked at. Clearly the lower socioeconomic status don't have the resources to adapt. If you're wealthy, you can climate-proof yourself. Yeah? If you're a farm family and others, maybe it's actually fishermen, it's resource people who are impacted by climate variability. It absolutely impacts their industry. So if you had sheep and now you actually need to move into cropping, it's a completely different agricultural operation to move into. And those with chronic disease, they've already got health conditions. They're elderly, they've got chronic disease, and they're particularly if they're low SES, then they're most vulnerable. So it became pretty clear for us that these were the key priorities that we needed to work in for those most disadvantaged. We needed to look at these social determinants. How were they going to have some sustainable, affordable energy? So this is to cool their homes, this is to heat their water, etc. Food security. We know that in rural areas, and we've been doing some food basket mapping to show that the availability of fresh food, the affordability of it, the quality of it is all a major issue in our smaller towns. household water, transport, social connection. Those were our priorities. And we've mapped and identified, well, where in our particular part of Victoria would, where would be the vulnerability? So now we're looking geographically, where's the vulnerability? So we're down here. This is our local government area. These two local government areas are the document that we've put together. You can see that red zone. This is the map produced by the Australian Bureau of Agricultural Resource Economics, and it measures vulnerability to change. So those most vulnerable are those in the red areas, and it's an index which matches their socioeconomic status, their levels of education, their internet access, their the environmental condition, their resources, environmental resources, and it has mapped that if these places have some structural adjustment, particularly in agriculture, they will be most impacted by change. So we're in the red. This was absolutely astounding data to our local services, and this is I got this map a couple of years ago, and we've used it so successfully to gain resources and funding, because there was a paradigm that we're living in the, if you like, the kind of good rainfall belt, good grazing properties, really no problems. Yeah, and this has been valuable data to show actually there's another reality. There's another reality about change and impact of change. We then used some Department of Primary Industries data. A fellow called Neil Barr, who works with Department of Primary Industries in social mapping. Fantastic connection. You'd love him, Judy. And this is showing he has mapped the different social landscapes across Victoria. So there are 3. I won't have time to talk about them all. We are in we've got some yellow zone, which is a rural transitional social landscape. That means that we are highly changing. I talked about the agricultural changes from wool to cropping and to actually out of wool into land production. We're also seeing our smaller towns decline, so young people moving out, some of our smaller towns, whether they are viable or not. So put those 2 maps together. We learnt the first one says we are very vulnerable to change in terms of our ability to cope with change. Secondly, this one's saying, by the way, you are one of the highest parts of, you're in the zones in the state of being impacted by greatest change. So it's sort of a dramatic story. So afterward, if you like, what we're doing is setting up a framework for thinking. That's what we have really kind of led in the state. People were wondering, well, what on earth could we do? So the next step, of course, was around action. Well, this is a question not about just analysing what the situation is. How do we plan? What are we going to do about it? So we took your fantastic Canadian Ottawa Charter and we started mapping the Ottawa Charter against each of our priorities. I've just given one example here, which is household energy. We really went back to principles. What does the Ottawa Charter say we should do? We should work across those 5 environments, policy to reorienting health service. And we started to map out what does the best evidence say, what do we think is the best way forward for working with our disadvantaged populations in each of those areas. So I'll give you one example. Policy. The one thing that we knew was if you were disadvantaged, you're living in a housing commission house, public house, that's weatherboard, it's not insulated, it's going to be pretty uncomfortable during summer. You're more likely, of course, to have a chronic illness, aren't you? Because you're at the lower end of your economic status, etc. So we've talked with public housing about across the state what are they doing to retrofit those homes to shore up, insulate them. Some very basic things they can do to those homes to protect those people during summer heat wave.